Hello and welcome to the Hormone Genius podcast. We're so happy to be here with you today, and we have a very special guest today with us, Dr. Monique Ruberu. I did not say that right. I'm going to start over, Jamie.
Okay.
I'm overthinking it now. I'm just going to have to say Ruberu because I almost
It's totally fine. Ruberu is fine. I just bought a Subaru, so Ruberu and the Subaru. It works.
I was like, I knew I was going to mess it up.
I know, it's like Ruberu. It's like
Ruberu.
Maybe think of like the Ru as like a, McDonald's. Donald. Ruberu.
It's Ruberu.
Dang it.
Right?
It's Ruberu.
Ruberu.
Yeah,
Ruberu.
Ruberu.
It's super hard now.
But don't worry about it. Whatever comes out is fine. It's totally fine.
That's hilarious.
Okay. Hello and welcome to the Hormone Genius podcast. We're so happy to be here with you today, and we have a very special guest, Dr. Monique Ruberu, and she is here with us today from Philadelphia. Dr. Ruberu is a OBGYN, certified physician, and she has a clinic called Natural Women's Health. And I met Dr. Monique, I would say, was it about 4 years ago? I mean, I've known you for a while in the sense that we've talked to each other kind of through, questions and answers about NaproTechnology, but I got to meet you at a conference for the first time several years ago, and it was just a blessing to meet you in person. Dr. Monique is awesome. She is very involved in women's health, and she is a great speaker, and that's one of her gifts and her passions is going out and speaking to women, to couples, to young people about so many things. And we're so blessed to have her here today. And she's going to tell us about some of the great new work that she's doing. And as you can see, if you're watching on YouTube, in her background, she's got Fertility Solved, the Power to Create, which is a new program that she's releasing. And we're super excited to hear about this because I know it's going to be information that every woman deserves and every woman needs. So thank you for being with us, Dr. Monique.
Thank you so much for having me. It's always so exciting to be with you guys. And this podcast in particular is just so important for women to really have the opportunity to understand how beautiful and amazing their bodies are and how perfectly they were created. So I'm happy to be here.
Yeah, very good. Well, we're excited to have you on, Monique. And why don't you just start off by sharing a little bit about you, just the basics, and then we're going to really drill in, and I can't wait.
Sure, wonderful. So I am a pro-life OBGYN, and I've been in practice for many, many years now. When I started off my practice, I was actually trained typically. So I was trained like a typical gynecologist who only knew how to write contraceptives, place IUDs, kind of shut down people's cycles whenever there was an issue. But it was really interesting because I reached a point in my life where my marriage was kind of on the brink of divorce, and it was miraculously saved. And because of that, saving of my marriage and my family, I decided I needed to do something different. And that actually led me to do something completely out of my box and go and pray outside of an abortion center. And when I did that, I encountered someone who gave me a book about NaproTechnology. I had never in my life heard about NaproTechnology, didn't know what the heck it was. I thought that I was a physician who was kind of pro-life and that I was, doing things in the right way because I was kind of standing against abortion. But what I didn't realize was that by writing the contraceptives and placing the IUDs and all of that, I really wasn't living that life that I thought I was. And so when I opened up this book that was given to me and I saw all of the amazing alternatives to treat every single GYN issue without the use of contraceptives, I was blown out of the water because I had never, ever been taught these things. And so I pretty quickly after that signed up for training, went and became a NAPRO trained gynecologist.
Oh my gosh. That's a beautiful intro. I'm totally hooked. I can't wait to hear the rest, but to know that your marriage was saved by this miraculous awakening of this alternative way to think and to treat women and to serve women. I can't wait to hear more. I can't wait to hear more.
Yeah, it was such a gift. I mean, we had been married for 10 years. And, one thing that I had never been taught was that in marriage, you have to have priority and you've got to, like put that higher being first, and then it's got to be your spouse. And that's completely contradictory to what we're taught in society. We always think that number one, you have to be first. And then after you, when you have children, your children have to be first. But if you don't, put that higher being first so that that higher being can like help you to be at peace and to be calm and to have strength, and then you don't put your spouse next so that you're sacrificing for your spouse is sacrificing for you, you're taking care of one another, you have this amazing strong bond, and then that love just pours down onto the children. So it's not that they're being left in the corner or neglected, but rather they're in a position where they have witness to what good marriage is. So by working on your marriage, you're actually protecting your children's marriage. But instead, if you prioritize your children and you neglect your marriage, then your children, there's no way that they can have a good marriage because they have no marriage to learn from, right? So yeah, that was
That's
an amazing
great
discovery.
advice to anybody listening out here. And what's so cool is I feel like what you have done in your conversion isn't it true that NaproTechnology in so many ways and understanding our bodies as women really leads to healthy marriages? And
Absolutely.
like it all is so holistic in what we do and what we're trying to accomplish by this natural procreative technology is what actually is probably saving marriages and saving relationships and saving women's bodies. So that's what's so incredible, is that it's all tied together. Like this is not separate.
That's so true. The beautiful thing about NaproTechnology, it's built on this system where you're learning these fertility awareness methods, right? Crichton Fertility Care Natural Family Planning is the crux of NaproTechnology. It's how we get all of our information. It's how we understand what's going on in a person's cycle. And so when a couple makes a commitment, or even a single woman makes a commitment to learn how to chart her cycle, then she has this innate understanding and respect for her body. And when a couple chooses to utilize natural family planning methods in order to achieve or avoid pregnancy, then they're never putting a barrier between themselves. They're never putting anything that's dangerous. It's like the husband is literally saying, okay, I know that this particular form of natural family planning is not harmful for my wife. And so I choose that because I prioritize her health and her safety and her peace over my convenience. And that sacrifice, that willingness to say, yeah, at the time when I desire you the most, when you're fertile and your hormones are raging and you just really desire to be intimate with your spouse, I'm willing to sacrifice that and just show you love in other ways, which will build our marriage and strengthen our marriage, right? Because most people don't learn how to show love to one another outside of sexual intimacy. So when you do have that toolkit of knowing how to show love to one another outside of sexual intimacy, that's what makes a strong marriage. So in times of trial, when sex goes out the window, you can still manage to show love to one another. And that's like such a godsend, right? So yeah, the whole concept of identifying what may be causing you to have PMS symptoms, what may be causing you to be more uncomfortable in the month, what may be, making you feel at unease, really looking for those solutions. And NaproTechnology is, I believe, the only type of natural family planning method that actually allows you to not only achieve or avoid pregnancy, but also to address every single gynecological issue that comes across, right? It's just so beautiful.
That's something that, as a fertility care practitioner, when I'm meeting with unmarried couples, who are sexually active, I just ask the question, what would happen to your relationship if you didn't have sex? Because before marriage is when you're forming that relationship, you're creating that base, that structure. And so it's just interesting to hear people's response. You know, would you guys break up? Would you guys stay together? You know, if you couldn't have intercourse with each other right now, let's just say you decided not to, how would you show love to one another? And then going in further to say, when you're married and if you have children, there will be a time that you will not have intercourse, like doctor's orders. But that's when your wife needs you the most. And so then what? When we need you the most as husbands, but then, you know, they're not getting that, you know, sexual intercourse, you know, how does that affect the relationship? So I just love what you said about that, Dr. Monique, is that, you know, that there's like this self-sacrifice of the man during that time if they're deciding to avoid pregnancy, and how romantic is that for the woman? We feel seen, we feel heard, you know, so I love that you brought that up.
And it's really interesting. I talk a lot about sexual integrity and chastity in my office. And I'm always amazed at how the truth really resonates with people, right? So if you come at it and you're saying, you are beautiful and you're amazing, gosh, you have such purpose in your life, and you've been created with such just immense joy and love and light, and you have so much to share. And I believe that the person who is destined for you, the person that would love you like you've never been loved before, is the person that wants to protect you. And so that individual would never want any harm to come to you. They would rather die than do something with you that would bring you to harm. And so by choosing sexual integrity, by choosing to say, and I take it to the next level. I don't even say don't have sex until you get married. I say don't kiss on the lips until your wedding day. Because when you're not making out with someone, it's so much easier to say no to having sex versus if you're making out with somebody, then you're telling your body that this is go time and every hormone is being released and, you know, every fluid is being released and you're preparing to have sex. Mm-hmm. And I said, but you know, if you choose not to, then you have this confidence inside of you, right? You are so certain that this individual is not with you because they're using you. And this individual is with you, and that even during the times when you can't have sex. So, say you're ill, say you're pregnant with your child and you have some sort of bleeding issue, and you're told that for the next 6 months you just can't have sex because you have placenta previa and it's going to bleed and it's going to put your life or the baby's life at risk, right? You know deep in your heart that this man is not going to go to a strip club. This man is not going to go look for somebody to relieve his urges because he just needs that satisfaction. You know that he's capable and that he knows how to love you even through all of that. And it's just such a joy for those women to know, to be loved, but in that way.
Mm-hmm. Really important message for all women to hear. Dr. Monique, I want to dive a little bit deeper into just your medical practice and really that conversion to NaproTechnology. And I kind of want you to, you know, tell us about what it was like and your experiences as an OBGYN prescribing medication like birth control, IUDs, and what was the difference you saw in not only like side effects, you could say, and the experience of women on those medications, but also the difference of what it's like to treat a woman and to actually give her answers and an alternative to that approach that Western medicine often is only giving to women.
You know, it's so sad for me. Just the other day, I saw a girl who came into my office and she had been placed on contraceptives to deal with an issue, and she was going to continue those contraceptives until, you know, she had surgery and whatnot. Her desire was not to be on the contraceptives, but she just didn't know what else to do. And what I wanted so badly was just to say, okay, just stop right now so that we can really understand what's going on. Because what happens is, you know, I treated women for years and years and years with contraceptives. Like they would come into the office and it's such a sad, boring way to practice because every single issue has the same result and the same treatment. Like, do you ever go to any other physician ever and expect to be given the same treatment for every single problem that you have? No, you'd think that physician is crazy, right? So you go into a typical gynecologist. When I used to be practicing in that way, people would come to me for abnormal bleeding, for PMS, for painful cycles, for ovarian cysts, for endometriosis, for trying to prevent pregnancy. For all of these things, I would treat them with contraceptives, and I would simply shut down their cycle. And when, that particular contraceptive gave them really bad symptoms, I'd switch them to another one and another one and another one and another one. And they would just go through this endless line of putting these horrible chemicals into their body that were just distorting their natural, beautiful hormonal cycles. And so now the difference is, every woman that I treat with NaproTechnology, we're no longer covering up the issues. We are trying to get to the very core, the very root of what is abnormal. And then we're addressing those things. We are giving them so many more answers than they've ever expected to be able to get. They are so empowered because they have this understanding of what's going on in their body every single day. Every single day, when they look at their charts, they can look back and, like, who remembers? Like, if I was to tell you, by the way, 3 months ago on day 6 of your cycle, did you have tail and brown bleeding? Like, everyone, like, what are you talking about? Like, how the heck would I know that? But the women who are charting with Crichton, they know. They're like, okay, so if I compare this month to 6 months ago when my aunt came over and we had this huge fight and we were totally stressed out, and then I had that abnormal bleeding and that delayed ovulation, I can see that. I remember that time, and I know exactly why my chart showed what it showed. And now I'm much more at peace because I've made up with her and I'm in a great place. And look at my chart now. I'm ovulating at the right time and I'm eating healthier. And you can see those changes that I made in my diet when I cut out the sugar and I changed to all grass-fed organic meat, rather than eating the cheap stuff. And I stopped eating at Wendy's. And look what happened to my chart. My bleeding actually got better and I'm not bleeding as heavily. And my pain got better too. Like, all of that stuff is reflected in those charts. So it's like this charting is another vital sign. And it's being able to chart, it's like journaling your entire life and all of the events that have happened, all of the stress that you've encountered, and all of the good changes that you've made that are reflected now in your bleeding patterns and your mucus patterns and the length of your cycle, all of those things. So when I look at a chart of a patient now, it's like reading a book. And it's so funny because I remember when I first started reading about Napro and when I first started doing the courses to become a Napro trained doc, I looked at this charts and I'm like, how the heck will I ever understand this? This is so ridiculous. Like, that, it's just a bunch of like stickers of green and red and babies. And like, I don't know what any of this means. But now, oh my goodness, when I see a chart, it's like this entire book of information about this person. And I can instantaneously, I can say, okay, I know that every month you must be going through a really challenging time right before your period. Like, it's probably really hard for you, isn't it? And they're like, oh my gosh, how do you know that? And I said, yeah, the just maybe interacting with your kids, the things that they did yesterday which didn't bother you, today it's like fingernails on a chalkboard, and you find yourself like really just fighting with your spouse and wanting to get away from everyone, and your breasts are tender and all this sort of stuff. And they're like, how did you know? And I'm like, well, you have tail and brown bleeding, you have short post peak phase, and all of your cycles are like 26 days. And I was like, you're basically going from PMS to abnormal bleeding to a day off back to PMS. So you always feel this way. And this is just not a way to live. So what do you think? Like, can we actually just do some work and let's get in and figure out what your hormones look like, and for the first time, typically when somebody says, I want to check your hormones, what they mean is, I want to check a day 21 estrogen level for you. What the heck does a day 21 estrogen mean? Like, nobody knows what the heck that means. Like, the only way you can ever interpret estrogen or progesterone is in relation to your ovulation. So if you know when you ovulated, then you can say, okay, this many days after ovulation, this is what estrogen should be, and this is what mine is, so I can compare it. But if you have no idea when you're ovulating, then there's no way to interpret this. And yet, these gynecologists are taught that by checking a day 21 progesterone level, you'll be able to tell if someone's ovulated, because if progesterone's present on day 21, then they're ovulating and they're fine. But if progesterone's not present, then this person doesn't ovulate. No, their mother-in-law just came to live with them and their ovulation was delayed because they're stressed. Like,
It drives me
crazy.
bonkers. It drives me bonkers, when we're working with women. Oh, I've gotten all my lab work, my progesterone levels are normal. And I think, how many days did you go get your progesterone level? Like what lab? How many days? Just one. I'm like, well, we're going to start over. Let's do this again.
Yes, I had this huge conversation on this. So I'm doing this Fertility Solved course now. And I have a really lovely Fertility Solved support group on Facebook. And so, all these people from all over the world are like reaching out to me and they're, hey, Dr. Ruberu, I am one of those people who has unexplained infertility, but I have done the complete workup.
Yeah.
I have done everything and nothing is wrong with me, but yet they can't figure it out. And I said, so when you say you had the complete hormonal workup, does that mean you did day 3 PCOS labs, looking at your thyroid really deeply, as well as all of, prolactin and PCOS and everything else, plus starting on like the first day where your estrogen starts to rise, did you check estrogen levels every other day until you hit ovulation? And then did you check estrogen and progesterone every other day until your next period? No, I just checked one level on day 21. And I'm like, yeah, they haven't really done a complete workup. And they're like, yeah, but they said they did. And I said, no, they didn't. No, they did. No, they didn't. So, like, I am happy to do your workup for you, or go get your workup done and I'll come and interpret it for you. No problem. But it's sad because these poor women are being sold this lie that they're getting complete service, but actually all they're getting is this subpar service, and they're all being pushed towards IVF because IVF is the money maker. And so, just throwing some Clomid at someone. I remember an infertility doc who was a lovely guy telling me in my office before I wanted to have anything to do with infertility. And he was like, hey, just, throw a couple of rounds of Clomid at them. And then, if that doesn't work out, send them to me. And they have this cookie cutter list of like, every person who comes to us, they do the HSG, they do the ultrasound, they do this baseline blood work, and then they give them 2 or 3 rounds of IUIs with Clomid or letrozole. And then if that doesn't work, you're obviously the only option for you is definitely IVF, because you're getting old. I mean, you're 39. Like, it's insane. It's insane.
Yeah, I see it. It's the same thing everywhere. I can't tell you how many patients that I've seen where it's that exact same workup and they come to you and you're like, oh my gosh, we have so much more we need to uncover.
Yeah.
And that's what's so amazing about, what we're doing is we're offering so many more answers to unexplained infertility. And we're actually allowing people to do what they want to do, which is just create a baby in the good old fashioned way that it was meant to be, without all of this assisted reproductive technology. And it's so much more effective. Dr. Monique, if you had a patient that just, was on the fence, let's say there's a 21-year-old person listening and, she's had really bad periods, really painful periods, really bad PMS. And she just is like, I don't really get what you guys are saying. Birth control has worked for me. It helps my periods. What would you say to a young woman that's just really not sure about what we're speaking, this language of you really can actually live in your own hormones?
Absolutely. So I think number one thing is think about what you're putting into your body, right? Everybody nowadays is trying to live a super organic life. They're trying to cut out all of the chemicals and all the preservatives in their food. Yet they fail to realize that they're placing a carcinogen into their body. Like contraceptive pills are actually labeled as a carcinogen in the medical community. And so they're placing this in their body every day. There have been multiple studies that show that with the use of these pills, that there is, or not only the pills, with anything that has this hormonal influence, that it has an increased risk of breast cancer. It has an increased risk of issues with your liver. It has, for people who have no idea, they may even be putting their lives at risk because if they have an underlying clotting disorder, they could get a PE, which is a blood clot in their lungs, and then they could just die suddenly without any warning whatsoever. And so you're choosing to do this. And what are you accomplishing by using this, right? You are not addressing the underlying issue. You're simply putting a band-aid on top of the issue. And at some point in your life, you're going to reach the stage where you want to have children. And then you're going to take off this band-aid. And by the way, this band-aid not only just covers up issues, but it also changes the way that you actually perceive things. So the people that you're attracted to while you're using this are different from the type of person you would actually be attracted to off of it. So oftentimes women will be on contraceptives from the time they're in their teens all the way until they're ready to have a baby. They get off the contraceptive and they find that they're no longer attracted to their spouse. And that's a big issue, right? Mm-hmm. It causes you to be attracted to a much more effeminate person than it does to a strong masculine individual. And there have been studies that have shown this. So it's really interesting. Rather than covering up your problems, wouldn't it be better to understand what the underlying issues are so that you can address them now? And then when it's time for you to have children down the road, you already have a game plan. You already know what steps you need to take and what precautions you need to take so that when you do conceive, you don't end up with multiple miscarriages. You don't end up with preterm delivery. You don't end up with postpartum depression. Progesterone is like the most amazing chemical, but it's one of the most important chemicals in our body. And it's not just during the time of pregnancy or during the time of even desiring pregnancy, because without progesterone, you end up having tail and brown bleeding. So your cycles, your periods are lasting for a lot longer. You end up having PMS symptoms. So right before your periods, for maybe the week before, sometimes even longer with some people, you have headaches, you have this desire to get away from people, you have irritability, you might have rage, you have breast tenderness, you have carb craving, you may have ankle swelling, you have changes with your bowel movements. Like, it's just miserable. It's not fun at all. Anxiety, depression, all of these things. And these poor women, because especially with really bad progesterone issues, you always feel like you're in this loop, right? So rather than addressing the issue, they get placed on Zoloft. And so people are now trying to treat depression with antidepressants, whereas all they really need to do is improve their progesterone. And it's just ridiculous. So rather than putting all these extra chemicals into your body to address all of these issues that actually have one root cause, you can understand, you can be empowered, you can have this ability to really know what your issues are and how to change that situation naturally by taking seeds, possibly by taking supplements and vitamins, by just improving the quality of your eggs. Like, there are things that you can do that are so simple that will modify this. And these tiny little changes in all these different areas will push you to a different place altogether, a completely different plane in your life. And you can walk about feeling so much better, have such better relationships, and be so much more successful in all the things that matter to you.
It's kind of like when you're saying this, it makes me think of how, like, this day and age, we're really into the organic, yada, yada, but also not just this day and age, but in general, I believe the Lord created us to seek his purpose and will for our life, right? Like, and so we're always wondering, like, Lord, what am I called to do on this earth? What's my purpose? And it's like our life's question. We hope that by the time we're 90, we've fulfilled something that can, improve generations to come. But I always think about the essence of self changes when we alter our essence. And because hormones affect so much of us, like you were saying, our behavior, our mood, our experience with the world, our ability to be attracted to the right mate, it's our essence. And I think women don't realize that they're given a short stick. We don't even know to expect or want something that's full. We don't realize that we're only getting half of a story or half of ourselves, or that we used this example before, Teresa, in a previous podcast, but that the vision is blurred. We have blurry vision, but we don't know that though, because we were never given a pair of glasses. So true. That, as you and Teresa and the work I do with NaproTechnology and teaching people to chart their cycle, that's what we're doing. We're giving everyone a pair of glasses, and it's beautiful to see what happens when they see. They can't help but share. And our whole business at the very beginning, 6-7 years ago, was only spread through word of mouth. No money spent on marketing anything. It was only word of mouth, because women couldn't not share what they had learned with other women. And so for all of you listening, if you're a doctor listening and you're like, okay, this story sounds familiar, maybe you yourself as a doc or a medical professional, you're thinking, oh my gosh, I want to know what these women know. And I've always felt like there's something I'm missing, but all I really know to do is to prescribe the pill, but I want better for my patients. If that is you, please reach out. You can reach out to hormonegenius@gmail.com. You can check out fertilitycare.org and get connected. Teresa, do you know the website for Creighton Education, the education program?
It's just at popepaulvi.com.
Okay, popepaulvi.com. So again, I just wanted to insert this, but if any of your hearts are just burning and you're like, I gotta learn more, please reach out and check out those resources.
Well, I wanted Dr. Monique to speak about this, because this is where, I do think there's people listening who might be going into medical school, or they're already a doctor and they have had this kind of yearning to kind of understand more. How do you approach that with speaking to other doctors?
What I share with them is, before I learned about NaproTechnology, I could not stand GYN. I was going through residency and I found GYN to be so boring. And I always thought, I'm going to be a hospitalist and I'm just going to take care of women during their pregnancies and I'm going to deliver all their babies. And I thought, I will never, ever, ever, ever do fertility. And I will never, ever, just be a GYN doctor. And I have, through NaproTechnology, fallen so in love with gynecology, because now it is so different. It is every day when I walk into that office, I feel like a detective, and I am searching for these underlying causes, and I am searching for places in these women's lives that I can help them make choices which will help them be healthier and happier and more fulfilled and have better relationships and come closer to God through what they're doing. And it's just so exciting. It's like every single day is just such a gift. And there's never a day that I'm in the office that I don't want to be there, that I don't want to be with these patients and I don't want to encounter them. And it's the same even for my coaching patients, that I encounter from all over the world. These people are trusting me to share their stories and to help me to get the clues that I need to interpret what's going on and to give them suggestions. And it's just such a joy. It brings so much fun back into the practice of medicine. And it really, oh my goodness, it's so wonderful. So if any physicians or medical students or nurse practitioners or PAs or anybody is listening to this and they want to learn more about NAPRO and how it fits into a practice. I mean, I was initially, I was in a group practice, and then I decided to stop writing contraceptives, and then the hospital decided to put me into my own practice because I was practicing differently from everyone else. And then after being in that practice for a few years, then I decided I needed to own the practice so that I could just do with it what I wanted. And now I own my practice, and now I, run courses and I do all of these things, but it's completely my work that I do. It's all truly just to serve God in everything that I do. And so it's a really fantastic thing. It's totally doable. You can absolutely be a mother and a wife and uh, own a practice and everything. It's all possible. And I know it sounds scary and it sounds like it's never done, but it's done, and it's done well. So not to worry.
Monique, thank you so much for spending time with us today. It was so inspiring to hear your story. We always wrap up with this question. And what do you wish every young woman knew about her hormone genius?
So I wish that every young woman knew that she was created perfectly. That even though there may be some variations in her bleeding or some abnormalities in accordance to what is completely normal, there is nothing that can't be solved or worked out. And all she needs is the right person to walk alongside with her, to support her. And that's what we aim to provide through Fertility Solved. So, through this particular program, women, whether they are currently trying to conceive or women who are just interested in being able to conceive in the future, they can all take this online course. It's a really simple, 6-module course, but then they can opt in for the coaching. And I guarantee you, once you take the course, you're going to have a list full of questions that need to be answered and things about your own cycle that you want to discuss with someone. And that's what the coaching's all about. And being able to actually interact with me and have me help you walk through that path.
Oh, amazing. Oh, Monique, we're so proud of you and for just your courage in stepping out and being receptive to what the Lord was calling you to. And women are benefiting all around for that yes of yours.
Absolutely.
So thank you so much.
And let our listeners know again, I mean, this Fertility Solved program, I want it to be clear where people can get access to this program, and also let us know how they can stay in touch with you, Dr. Monique, on social media, on your website. Please give us all the platforms that are available for people to reach out to you.
Absolutely. So the easiest way I think to access the Fertility Solved course is just by kind of linking to it through my office. So the Fertility Solved course is going to be one of many courses that Natural Women's Health offers, and this is the first of them. So this is going to be a Natural Women's Health course, or kind of school in a sense. And you can just go to naturalwomenshealth.com. And on there will be a page for these courses, and for the first one, which is Fertility Solved. I am present on Facebook, so you can just search for Dr. Monique Ruberu or Monique Ruberu, and you can reach out and I'll be happy to friend you. I'm present on YouTube. I have a YouTube channel, Dr. Monique Ruberu, and I have lots of videos that I have taped there about all sorts of GYN issues and how to address them, about marriage, all sorts of stuff. I'm also on LinkedIn, so you can always find me there, and I'm posting there, and on Twitter too, and a little bit on Instagram as well. But you can always reach out to me, even on my Natural Women's Health website. There's a little chat box, so you can always shoot me messages through there, and then I can direct you as well.
Awesome. Thank you so much. All right, listeners, if your heart is burning, especially if you're a medical provider and you want to learn more, please take this moment to step out in faith and learn what you can about all of how you can treat your patients. Thank you, Dr. Monique, for your time, and have an awesome day. Thanks, Teresa. Good to see you again, too.
Thanks so much. It was great to chat with you.